Welcome to today's installment of SU Teaches SU. Today, we're going to talk about test anxiety. My name is Ruben Rodriguez, and I am the Director for Medical Assisting here at Southwest University.
And I'm Taisha Goodrich, the Testing Coordinator here at Southwest University.
Well, let's get started. Test anxiety, by definition, are physical symptoms and emotional reactions ultimately interfering with our performance.
That's right, and these feelings can be debilitating. But in this episode, we're going to teach you how to use those feelings in your favor.
We're going to touch a little bit on how does anxiety feel. You can have feelings of impending doom, nausea, inability to concentrate, anger, even headaches.
Some physical manifestations of anxiety may result in heart palpitations, feeling faint, feelings of frustration, and fear.
Let's follow up a little bit with an example of testing here at Southwest University. The Medical Assistant Program tests for the CCMA, the CPT, and the CET. Most of you will know that we have these examinations in classes like EP 101, EP 102, and CP 101. Study guides and practice exams will be provided for you, and the exam will be scheduled for you in the last weeks of the mentioned courses.
At Southwest University, we work very closely with the NHA. That is our certifying body here. While you take 3 certifications, today we're going to focus mainly on your CCMA. The CCMA is a 3-hour exam. You have 180 questions to answer. There's only going to be 150 of those questions scored, and 30 of those questions are going to be pre-test questions. Pre-test questions are used just to gauge the knowledge of the students taking the exam at that time. So, on testing day, you'll arrive to your testing scheduled room. All of your personal belongings be left at the front, and then you'll come on in and choose a seat. Remember, your exam is scheduled for a specific time. Please make sure to arrive on time.
Some further tips for the NHA, and specifically the CCMA examination, are going to be: take your time. You have 3 hours for this particular examination. As much as you're tempted, do not go back. Your first choice is usually your best choice. And then after that, remember, the people who write this examination may not speak like I do, like you do, and the terminology may be different. So really hone in on those study guides and see how they are asking questions. The verbiage that they're using to ask these questions is going to be essential for you to be able to understand the examination. I can give you a quick example. A winged infusion set in our laboratories or any other laboratories are known as butterflies, but on the exam, they are winged infusion sets. Identifying these nuances will help you be successful on these examinations.
That's right. Remember, you get 3 hours to answer 180 questions. If you do the math, that's exactly 1 minute per question. So do take your time. Make sure that you're reading each question carefully and in its entirety.
Guys, medical terminology saves lives. You can identify the terminology within the question, and it could actually get you the right answer. Sometimes these questions are very long, but they're only asking very simple concepts, or they only are asking one thing.
Remember, only answer the question that is being asked.
Now to testing anxiety. Usually every method that you identify when you research testing anxiety is going to be about state breaking. So what is state breaking? State breaking is really focusing somewhere else other than the anxiety-driven feelings that we have when we're about to test. So refocusing that power and refocusing that knowledge into something else.
It's important to remember to practice these tips and tricks prior to taking your exam. If you come in prepared, then you'll have less anxiety on testing day.
Of course. So let's go on to some state-breaking tips.
Tip number 1 is to stay positive. Speaking to yourself in a positive tone and telling yourself from the beginning that you're going to do well on this exam is the best frame of mind to enter into a certification exam.
I can do it. I'm the best. Visualization. You want to be able to see yourself in the future goal. So you want to be focused on your outcome, as focused as you can be. So once you're there in the examination, you also want to focus and put yourself mentally where you want to be. If that is in our specialty programs, or if that is in a clinic, a desired place to work, you want to really put yourself there and imagine yourself there.
Anxiety can cause muscles to be very, very tense. So before your test, if you're feeling this way, remember, it's okay to stretch and move around a little bit. Make sure that you get into a relaxed state, not too relaxed, but a relaxed enough state to be able to focus on the task at hand.
Also, deep breathing and visual focus will always help with anxiety. One of the tips is to really hone in on a place on the wall, maybe a wall outlet, maybe somewhere on the computer. When we focus so intently on something, we don't give our minds too much place to wander. So you really can't think about any of those anxiety-driven thoughts that could be affecting you and affecting your performance. So again, hone in on one specific dot, hone in on one specific thing that you're looking at, and you could do this for a couple of minutes, and that would definitely help break that type of state. And finally, just get happy with it.
Get happy?
If time permits, and if the testing permits, just shake it off.
Shake it off.
Shake it off, guys. It's one of the best things that you could do, and just act silly a little bit, just enough to not get kicked out of the exam.
I won't kick you out. Perfect practice makes perfect performance. So remember that you need to prepare before you go into this exam. Let's start by getting a good night's sleep and a well-balanced meal the night before.
And make sure you study. I mean, this is the number one thing that I could recommend is make sure that your preparation was good. Make sure that you did everything that you could. Once you're on test day, there's no more studying. Just go for it. The knowledge is there, and trust yourself. Really trust your studying. You do have 6 weeks. You do have more depending on what exam it is. And just trust in your abilities, and you will definitely do much better.
That's right. You know what you know. So come in and put that information in your exam.
Wonderful. The next one is be early. There's just so much about comfort, about being aware of your surroundings, and actually having the time to breathe. If you're rushing through to get to the testing center, to get to the testing room, then maybe the result is not going to be that great. So you want to be able to sit there, collect your thoughts, and then go into the examination.
Exactly. If you feel rushed when you come in, you're already in the wrong frame of mind to take this exam. So please make sure that you're prepared, show up early, and come in ready to take this exam.
On exam day, you want to skim the exam if possible. I mean, it's just really getting familiarized with the questions and looking to see how they're structured. The next thing, on multiple choice, and we've mentioned it before, do not go back. On multiple choice, your best answer is usually your first answer.
Right. Trusting yourself, I think, is going to be the biggest takeaway from this video. Make sure that you understand that you already have the knowledge to be successful in this program and anything that you choose to do in your life.
The next thing is to paraphrase the question. Again, there could be a whole paragraph on something, but the question could be relatively easy. So make sure that you put it in your own words and you truly know what the designer of the question or the people asking the question, what is the test asking me? And like I said, the question could be extremely easy for you, but there's a lot of filler in there. So make sure that you dig through and you're able to paraphrase the question.
On test day, think of the answer to the question before reading the answer choices. If you using your own brain for the information, you're sure to get that question right.
That's right. This concludes this installment on Test Anxiety of SU Teaches SU. Again, my name is Ruben Rodriguez, and you could contact me at rrodriguez@southwestuniversity.edu.
And I'm Taisha Goodrich, and you can reach me at tgoodrich@southwestuniversity.edu. Please remember, guys, a test is just a test of the knowledge that you know. And if you don't pass on the first time, just come and see me in 30 days. Have a great day.
Thank you.
Bye.
Bye.